Good afternoon and good evening, everyone. So, today I'm just going to share my experience with you. This is nothing sort of sharing the materials or anything like that. So, it's just how I prepared the first time because last time when I passed, it was my second attempt. So, what I did wrong in the first attempt. So, let me start with the March 2023, how I started preparing. I applied for the exam in December, and then, like any other microbiologist from India, I started with books. So I started with the Javits and basic Greenwood kind of microbiology book. By November, when I started planning, I'm going to give part one. And with that, I started getting materials for part one at that time. So the MCQ books, I started with Moore, and then I went on to tutorial topics in infection, and I followed handbook as well. So the problem with this is because the Moore is it was first released in 2015 and it never got updated. So that's one issue. And second one, most of the guidelines has changed from that time. And the tutorial topic, it was the edition was released in 2019. Most of the guidelines has been updated after 2021 or 2023 itself. So everything is new for us. So you have to stick on to the recent guidelines rather than you can go through these books, you can follow the books, but this is not the ultimate answer kind of question you have to follow for any uh, clinical scenarios for management or diagnosis. Do not follow these books. Go for the guidelines instead. And third one, I used Oxford Manual. Again, it is from 2017, and most of the guidelines are outdated. So this one you can follow for the basic reading, like micro kind of reading, but not for the clinical management or any diagnosis and management related UK guidelines kind of thing. Don't follow any of these book for UK guidelines kind of question. Just go with the guidelines, UK HSA guidelines and UK SMI. So this is the recent UK SMI, which they have changed in 2024. So if you go to this page, you will have a lot of materials which is available for us to go through. Most of the questions are concentrated from this particular uh, document. So first time when I started preparing, it's a huge document. Each document or each organism will be around like 20-30 pages. And since I was from India, I had no clue what kind of questions I'm facing for the exam. So I just started reading the guidelines for each organism. And one more mistake I did was I never took any kind of notes from it when I read the topic. That's the biggest error because once you read the 50-page document, if you're not having your own from it, that is, you have to create your own notes. If you're not doing that, then when you revise for the exam, you will not be able to get back to the and you have to read it again from the start. So it's kind of a and I didn't have much time because I had only 3 months. And at that time, I was applying for jobs at NHS and I was going through some other thing as well. So I couldn't, but I prepared with one of my junior colleague. Most of you would have known her, VD Arora. So she was giving her final exam at that time. So we started preparing together. But within that 2 months' time, we couldn't cover everything in it. So that's the problem. This document is huge. So whenever you read it, I will see how to take notes from it later. But initially, I just gave a read through for all the documents. But that didn't help me much in the part one exam for the first attempt. And next, I started following the PHE guidelines, also known as UK Health Safety Agency, that is Health Security Agency guidelines. So each organism for the management clinically and also for the public health management, you need to follow this document. So all the laboratory diagnosis kind of thing, you need to follow the UKHSA, UKSMI, and UKHSA is for management and public health management and outbreak management kind of stuff. You can follow this. This is the most updated. So whenever you're taking any notes, for example, if you're preparing for pertussis, you need to follow the UKSMI. You need to start with the UKSMI. You can start with a book, for instance, you can go for Oxford Handbook, You can read the theoretical stuff from there. Then you can go ahead with the UKSMI, create your own notes, and then go with this UK HSA guidelines. So this will cover the pertussis in total. So if you want to read an organism, you have to go in this way. This I didn't create in my first attempt. I randomly read through the guidelines. I didn't go systemically for the first attempt. So, and these were some guidelines which we followed. And if you see, all the guidelines are updated in 2024 and 2023. So never ever download a guideline and start reading that. If you're applying for an exam, just contact anyone in UK or use a VPN network which you can download the documents directly from or read it online. That's most advisable. In the first exam, I have downloaded most of the documents and I was reading through from that. And most of them were from 2019 and 18, and most of them got updated between 2021 and 2023. So I missed on that point. So that's one of the important points you need to remember. So this was my kind of first exam preparation. This was the idea I had about the exam. These were all the documents I have to read, kind of thing I created, but most of it I couldn't complete within that duration. And I never knew about British Infection Association when I gave the first attempt. One day before the exams, I came to know about it. And even the micro registrar and Moodle, I came to know about it in Jan, just 1 month, 1 or 2 months before the exam. So I had no awareness about BAA and micro registrar for the first attempt. So these were all the things which I used as a reference, or this was my kind of checklist to be completed before the exam for the first attempt. And this is my result. So I was not plan I didn't plan anything. That's the first disadvantage. And I failed by 1 mark. So it's like when I started the preparation in December, I just started reading the theory books, and I knew about BIA only in March 2023 after joining under Dr. Banji, and then I got access to it only from March because one of my trainee colleagues was having access to it. So he shared the password with me. So I started using BIA in March. And Moodle, I created an account and requested the password to Dr. Banerjee between mid-Jan, I think. So I got it from, and I started reading Moodle or micro registrar in my mobile phone rather than the laptop or iPad. That's one of the biggest disadvantage. Don't use Moodle or micro registrar in your mobile phones because most of the documents or materials you will not be able to read through it. Later, I realized laptop or tab is the good thing to read if you are going ahead with the Moodle. And I couldn't complete all the guidelines. I couldn't concentrate which one to take, which point is important, kind of thing. I was clueless about that. And I didn't know how the questions are going to be. And I read most of the guidelines offline, as I've already mentioned. And most of them got updated in between. So I missed on that point. And also I was not practicing in UK. Like I was not a microbiologist in UK at that time. I just joined the department in mid of Feb, around 13th of Feb. So before that I was not working in UK as microbiologist. So that's one of the disadvantage, because you don't know what is going on here. So with this experience in hand, I started preparing. After the results came in May, I started preparing for the second attempt, and it was September 2023. So I had around 3 to 4 months in between. So I started preparing since from receiving the results. After receiving the results from June, I started preparing again. This time, I started writing down what's my plan for a week. I took time. What are all the things I need to do properly? So I started writing down what are all the things I need to do. So it took 1 or 2 days for me to sort out how am I going to go about. So first, I wanted to read the BIA questions, do it properly by reading the references and guidelines under that. That means just not doing the questions, but also going through the documents which is given in the reference. But few of the documents will not be opened, so don't worry about that. If you can access, just access and read it. If it is not accessible, then it's totally fine. And also few of the BIA guidelines, if it is too recent, for example, if the measles guidelines is 2024 guidelines, it may not be updated in the question. So you need to consider the UK guidelines. Whenever you're answering a question, if you get a doubt, please go to the UK HSA guidelines and refer to the guidelines. That's the ultimate chance, because all the questions are based on the current guidelines. So just follow the guidelines. And next, I was having an important source, that is microregistrar or the Moodle. And this time I was able to read most of the documents from Moodle. Before the exam for around 1 week, the first attempt, I took around 10 days of study holidays before the exam, but I was using all the wrong materials for preparation. For the second exam, I couldn't get any study leave, but I took 2 days off and the Saturday, Sunday before the exam. So it was around 3 to 4 days before my exam. So the entire week, starting from Sunday, I was using only Moodle and few of the notes which I took from random topics like UCAS and other things. So I was going through that. I didn't touch any of the other things. I was working at a hospital at that time, so I just went through the Moodle before the exam. Docs handbook. You can use this as a basic microbiology handbook, but don't use it for management or don't use it for the current guidelines kind of treatment or diagnosis kind of things. Don't use it. Use the guidelines for that rather. And the next one was you need to know the weightage of questions. If you're going for medical microbiology part one, you will be having 125 questions, which you need to complete within 3 hours. So you have to manage your time. And all the question, most of the question will be having a long stem. That means the clinical scenario will be a bit longer, and you need to answer the question at least like you need to answer it within 1 minute kind of thing. Even then you need to have some 20-30 minutes in the end, so that you can go back to some questions which you had some doubt, but always stick on to your first guess, because it's mostly right. That's my uh, mentor's advice, and I followed it. And also, whenever you're answering a question, just read the last line of the question first. If it seems the question is so huge, like 8 to 10 lines or more than that, then go to the last line. That will be the crux of the question. So read that first and then come back to the question. Sometimes they may ask mechanism of action of the drug after giving a long scenario. So you need not waste your time reading the entire scenario to answer that question. So you can go to this last line in the question and then come back to the stem. So it will be easy for you. That is one thing which I got. This is a good message to handle your time well in the exam. And next one, I followed few of the online resources like Travel Health Pro. This website has the recent travel or recent travel associated infection kind of picture. So this is one website which we follow in UK, NATHNAC, and the other one is CDC Yellow Book. So whenever they ask some question, mostly they will ask some questions like, for example, they will ask a soldier returning from Belize who has been there for 1 year, returning with some kind of lesion in the face or something like that, then you need to know what are all the recent outbreaks going on in Belize and where is it, first of all. So you have to know according to the continent and place and other things. You cannot remember everything in that. At least try to read for last 2 to 3 years. If you're going for 2024, I would strongly suggest to read from 2021 till 24, so that you will be having an idea when you give the exam that this is the outbreak going on in that local area. I cannot master everything within that duration. At least you need to have a gist of what is going on. Most of the time, I get it wrong. So it happens, but at least try to remember some few outbreaks which is going on at the moment within 1 or 2 years. The next one is Green Book for Immunization. This one is you will get minimum of five to seven questions from this, and it will be easily answerable question. but it will be from the green book. So most of the immunization question, you need to follow the green book. Either it will be about hepatitis A, tetanus, rabies, or um, even simple topics, but most of the time it's about when to give, when not to give, when to go for immunoglobulins kind of things, and other will be the guidelines will be very proper in this book, so you can follow that. And for HIV, for the first exam, I got around 3 questions. And for the second exam, I think I got around only 2 questions, or 2 questions, I think. So it's not more than that. If you see the HIV document, it will be around pages to pages, and it's a huge document you cannot finish within the time. So don't waste your time. Just concentrate on few topics which they routinely ask. So for the second attempt, I didn't go for reading all in the entire document for the exam. Rather, I stick to concepts like what is the regime routinely used in UK? What do they use in hepatitis B and HIV co-infection? HIV and TB co-infection? HIV in pregnancy? HIV in renal disease? HIV in cardiovascular disease? These 5 things I wanted to cover. So I read or concentrated only on that topic. And then I read about HIV resistance because most of the questions are from the resistance or these 5 topics. So I didn't waste my time reading the entire document because I couldn't remember it very well because I'm not practicing on HIV medicine here. So I couldn't remember it all. So I started taking gist of the important topics which they are concentrating or asking repeatedly. So I did only that work. And apart from that, in HIV, they might ask about opportunistic infection. Most of the time, either they will ask about toxoplasma or it will be about the PCP pneumonia. So the PCP guidelines is good. So you need to remember because definitely you will get minimum of 2 to 3 questions on that. And you might get some questions from toxoplasma in HIV or Kaposi sarcoma in HIV kind of thing. So those are all the opportunistic infection they routinely ask. And for my exam, for the both my exams, these are all the questions I got. So don't waste your time too much on HIV and reading about it, because the concentration or the weightage is going to be 3 to 5 question. So balance your time and effort you're putting in. And next one is BTS guidelines for TB and NTM. Again, this document is also huge. If you're reading, what I would suggest is mostly they are asking about mechanism of action. That's the crux of the drugs, or they will be asking about adverse effect or the contraindication or any drug interaction kind of question. And then they will be asking about the resistance. What is MDR, XDR, and that sort of question. So what you will use in that circumstance. So that's the 3 things which I read about TB. And NTM mostly it's random question. You need to know the theoretical aspects. They might ask a simple question like um, how do you differentiate between bovis or which antimicrobial mycobacterial drug it is resistant to intrinsically kind of questions. So it is like or it can be like cardiopulmonary transplant, or they have used the bypass and the patient is having some NTM infection kind of thing. Then you need to know it is Mycobacterium chimera they are discussing about. Or if they give some history like laparoscopic surgery in Asia and the patient has come to UK, a renal transplant patient or immunocompromised patient with laparoscopy in other country and coming back to UK with kind of infection, surgical site infection, then you need to think about Chiolne. So all those are the questions which I got from NTM, and also one question from Marinum. So they are asking random questions on that. So you need not worry about because most of the time, if you cover the theoretical book, any one on NTM, it will be fine. And next is the miscellaneous topics, either statistics and quality control. Definitely, you're going to get minimum of 6 to 8 questions from these topics. So this needs a weightage, and If you follow Moodle for this, that's more than enough. If you know what is sensitivity, what is specificity, and what is vertical audit, horizontal audit, that kind of questions they are asking, and positive predictive value, negative predictive value. So those are all the formulas you need to remember. And they can ask number need to treat kind of questions. And quality control, they are asking about audits, vertical, horizontal, and they are asking about Westgard rule. So those are all given beautifully in the Moodle. So just follow that. If you're reading UKSMI, it might be a bit confusing for the first time if you're not applying it in the lab. So it is better to follow Moodle for that concept because it's given with a picture and it's easily, it is like if you read and summarize the document, it's given in that easy format. So that is helpful. So go for it. And last one is antimicrobials. You need to remember all the drugs with the mechanism of action, with the drug interaction, and PKPD kind of questions. So this, they can ask any antibiotic or antifungal or antiviral, but you will have minimum of 8 to 10 questions in the exam only on the mechanism of action or any new drug, or it can be drug interaction kind of question, or intrinsic resistance or ESBL, MRSA kind of question. So you will have minimum of 8 to 10. Minimum, like, yeah, this is the most common question. So try to remember everything on UCAST, intrinsic resistance and resistance mechanism. So this was my plan. So I have reduced drastically from the first initial plan, and I started concentrating on the topics which is important in the UK at the moment. And next, there are few documents you need to read. This I have already suggested, the travel related healthcare advice in UK. This is followed by NATH NAC document. Another one is rare and imported pathogen laboratory. This you need to remember because most of the Zika and all the travel related things are referred to this lab. So if you go to their page, it will be around 20 to 30 pages, but this is worth reading because you might get around 3 to 5 questions from this document. And resistant phenotypes. This one is intrinsic resistance kind of thing. If you remember, most of the time they give like a antibiogram kind of picture and they will ask which antibiotic you query kind of thing. For example, they will give Klebsiella, they will give sensitivities like for like a Vitex sensitivity kind of thing, and they will suggest they would have given amoxicillin as sensitive. So the last line will be which antibiotic do you query? Then you need to select amoxicillin because it is intrinsically resistant, but it is given as sensitive. So that's that kind of questions you will get from this document, and it will be around 5 to 6 questions easily. So this time, what is the difference I made to my preparation was I had the theoretical knowledge about microbiology, but my application was a bit rusty because we never use it in that way back home. So I started practicing in UK. So that's one advantage I had. And apart from that, I started using Moodle efficiently rather than using it on the mobile. That's one good thing I did. And all the topics in Moodle are like current scenarios which is happening in UK. So most of it you will cover without going to multiple documents or multiple guidelines. So that's the easiest form of revising it. And second one, I was able to complete the BIA revision and I was able to re-revise it before the exam as well. Most of the questions are similar to BIA questions in the exam. So that's one thing. And the other one, it's not a theoretical exam like NEET or whatever exam we give back home. So it's most of the time they give current, they give a scenario like what I face in the clinic. So whenever I'm doing the practice as microbiologist here, I'll be getting GP calls. So most of the time, the scenario will be the GP call, how they present and what questions they will be asking. So it is like you do it regularly on practice and eventually you will answer it better. That kind of thing. So it's microbiology concept rather than how well you have understood the concept, rather than remembering or memorizing things. And next, it is UK guideline based exam. In the first exam, I could have passed the exam if I could have followed the Westcard rule from the UK guidelines rather than the American guidelines. It was 4SD kind of question. According to US, you will reject the sample, but according to UK, it is considered as warning and you will accept the sample. So you will have lot of difference between UK and US guidelines. So always try to follow the UK guidelines rather than any of the US guidelines. Only if it is not available in UK, like few of the mycology documents or something, then we might follow the IDSA guidelines. Apart from that, most of the things are available in UK, so we will be following the UK guidelines. And they will be checking particularly whether we are answering the UK guidelines kind of answer. So that's one of the thing. And other one is most of the question keep in your mind you are going to be a safe doctor. So you're not trying to kill the patient. You're going to select an option which will save the patient, even if it is more preventative. Go for it. If you feel you don't know, you don't have any clue about the question, and your options are very vague, then go for the safest option you feel. Don't choose some random answer. Try to choose something, even if it is extreme step. Go for it if it is saving the patient. And that kind of response they needed in the exam, I think. And any guidelines you read, you will have an algorithm or tabular column given in that. When you go through that, you will have a footnotes at the end. It will be very teeny tiny, but that notes will be the question. So from what I have experienced, most of the questions are prepared from the footnotes. So even if you read UKSMI, try to go through the footnotes because that has all the points which is not included in the algorithm, and that covers the gist of the document. So try to read the footnotes. So this is my colleague's notes, which I got for the first exam just before 2 or 3 weeks before the exam. But this document was prepared by him for himself for his exam. And when I read through this file for the initial preparation for March 2023, most of the concepts I couldn't remember, or I couldn't get it. Why he is writing this kind of management, or what does this short form mean? And few of the guidelines are outdated because he prepared it before us. So most of the guidelines, the rash guidelines, viral rash in pregnancy, everything got changed in 2023 and 2024 as well. So that was a bit outdated. So what I did was this, I took it my, like how I need to prepare a notes. So with this example, I started preparing my own notes. I could able to prepare for uh, most important guidelines alone, like viral rash in pregnancy, measles, diphtheria, pertussis, and then I went for common infections and travel related infections and brucella, all those culture negative kind of infections and random ones. So I started doing in that way, and TB and HIV. Whatever I read, I prepared it like a note so that before the exam I can just go through it and finish it off. The revision could be finished within 1 or 2 days, kind of thing. So I started preparing something like this for my exam. So whenever you're reading an UKSMI, these are all the examples which I have given. So if you go through the CMV, that is cytomegalovirus, you will have an algorithm in the last page, last few pages. So what you will do if it is reactive, if it is non-reactive kind of thing. So mostly all of us will read this page, but we will never go to this footnotes, or sometimes we will never take it seriously. But the questions are mostly from this. What do you do after diagnosing it is CMV, avidity, low kind of picture? What you will do after that? What are all the things you will do, and what are all the steps to follow? That will be given in this footnotes. So try reading the footnotes because it is very, very important, and most of the questions are based on this. And how do you take notes from the UKSMI? First of all, I had a big trouble of going through the huge document. I didn't know what to remember, what not to remember. So when I started preparing for the second time, I realized they are concentrating on only few areas on that document. So initially, you will be aware of all the basic information about pertussis. So that you can remember. But after that, what are the new things you will see in the UKSMI? First, specimen processing. It should be in containment level 2. This is important for all the organisms because any organism can be asked in the question. So it can be even Rosella or any of the organisms. They will give examples and they will ask which organism you will process under containment level 3 or 2 kind of questions. Even you can remember with the list if you are able to memorize it. But this one is good. So this document, they will ask questions from this specimen processing kind of section. And also they will give exception when you need to process it under CL3 as well. So, if at all you're processing something in the biosafety, that is containment level 3, what are all the organisms kind of questions? All those you can answer by reading this area. And most of the time, this PCR and other section, it will be given in the UKSMI. So, you need to consider this as well. But you need to compare with the PHE guidelines. So, if you see, this is what you need to remember. So, for clinical details, you will have all the symptoms, and clinically, if you suspect, what are all the specimens you will collect and what's the media you will use. If you remember that, that's more than enough. And this is PHE guidelines, that is UKHSA guidelines. It's not UKSMI. So if you suspect, what's the duration or when do you collect or when do you do each investigation? This will be given in that. So you have to combine both UKSMI and UKHSA guidelines for pertussis. This is one example I have quoted. So if you do it like this for measles, diphtheria, all the other organisms, then it will be easy for you when you go for the exam. You need not go into the guidelines every time you want to revise something. So that was one thing which I created. And what are all the recommendations for treatment? You just need to remember everything for the purposes. So once you have created this 5 or 6 pages after reading the UKSMI and PHE, your purposes is done for once and all. So you can just keep it away and you can revise it before the exam. So your notes should be containing all the details and one organism should be compiled into a file, and that's done for your exam. So, what are the miscellaneous topics which I have already mentioned? So, first is outbreak. What are all the types of outbreak? They might give something like a graph and they will ask whether it is a point source or is it a continuous kind of source. What's the source of outbreak kind of questions? And then statistic kind of questions, sensitivity, specificity, PPV, NNT, number need to treat. And they can give histograms, they can give graphs like forest plot, or uh, they can give random histogram and they can ask what is the statistical representation here kind of question. And then quality control and audit, which I've already mentioned. Viscard rules is important. And next is ventilation, air and water, minimum of 3 to 5 questions in every exam. All the exams you will get ventilation, air, water quality kind of questions. So it will be minimum 2 to 3 questions. So you need not waste your entire life reading the HTM document, which I did for the first attempt, and I couldn't remember anything from that after reading that. That's the horrible thing. So it's a huge document. So you will waste a lot of your time. Don't do that. Go to the Moodle and read only the document in the Moodle because it's beautifully prepared from the HIS document, and Dr. Banerjee has done a wonderful job of preparing it, concising, and doing it like you can do it like a revision. And with that 2 or 3 pages which he has created, that is gist of the entire HTM document. So you can stick on to that. And I could answer all the questions just with that 2 to 3 pages in Moodle. So you should be fine if you read that. So, yeah, that should be done with that. And last one is immunocompromised patients. Definitely, you will get 3 to 5 questions on that. For the first exam, I got around 7 or 8 questions on that. And for the second exam, I got around 5 questions on immunocompromised or transplant patient kind of question. Mostly, they concentrate on CMV in a renal transplant or adenovirus in a stem cell transplant child, or they will ask treatment of choice for adenovirus. It's always cidofovir. And some questions like EBV post-transplant patient with EBV viral load of 70,000 or 1 lakh, and they will be asking what are all the complications, or what is the prognosis, or that kind of question. So you need to remember about the post-transplant lymphoproliferative disorder, PTLD, and when how do you monitor and how do you treat it. For most of the EBV kind of questions, we don't treat them in UK until unless the level is more than 1 lakh, and we just I'm not a virologist, so mostly you will go for a virologist opinion in that case. So the first step will be decreasing or reducing the immunosuppression level. That's the answer. That will be the answer for the question. Out of the 5 options that will be there, if that is not there, then infliximab will be the next option, or any immunomodulating, that is biological agent kind of option. So they will give very basic questions, or very basic kind of, they will expect only the very basic option, because we are not virologists, so they will not give complicated options to us. So that will be the sort of questions they are preparing. And also they might ask some questions like, uh, you have 3 patients. One patient is having shingles, other patient is having varicose, yeah, one patient is having shingles, one patient is positive for MRSA, and one patient is positive for maybe they will yeah, give like Legionella, and one patient is positive for TB. So which patient you will prefer, or isolate in a side room or negative pressure room kind of questions, or something like that. So you need to score them, categorize them, and you will be, MRSA can be managed with hand washing, and you can manage the shingles and other things. If the patients are not immunocompromised, then you can manage by barrier nursing. You can keep them in the bay. It's not like they need to be in the side room. But if it is a TB positive patient, then you will put them in the side room. So it will be kind of clinical scenarios they will give and ask. But this will be very long. And if you read the last line, then it will be easy for you to do the answers within 1 minute. Like you have to give only 30 to 40 seconds for each questions. Then only you will be able to complete the exam within 2.5 hours, and last half an hour you can go through the questions again. This is also important. This one they can ask whether which which pathogen belongs to category 3 or hazard group 3 kind of questions. And also they can ask which containment level you will use for processing that pathogen. And this they can give the picture and they can ask, what does this mean? So whenever you're reading green book, you should have a gist like this. So for a rabies patient, what are all the things you will do? How do you risk assess the patient? How do you categorize them? Which patient will need immunoglobulin? Which patient will need vaccine? All those will be available in the green book, and you can go through the documents. So green book is useful for something like tetanus, rabies, hepatitis A, HBV. All those questions are mostly concentrated, or the notes will be easier in green book, so follow that. And this document is very important from UCAST, that is detection of resistant mechanism. You can use Moodle document, that is also very, very much easy to follow for ESBL. They can ask, they can give antibiogram, ask us to select whether it is class A, B, or C, or D kind of questions for ESBL. So you need to remember all those sensitivities and how do you detect ESBL kind of thing. So if you are preparing for the next session, then you need to start preparing now. So first you need to create your plan, how you're going to go about. And this is based on like this exam you need to prepare for minimum of 5 to 6 months. Um, since I have wasted my money in the first attempt, like I have failed in 1 mark. So this exam, if you prepare right, you cannot fail. But it's easy to fail in the border mark as well. So you're risking around 70, 80,000 easily. So uh, the wise advice is to prepare for 5 to 6 months and go to the exam and surely pass the exam and come back. That's the easiest way I will advise. And also, if you prepare for 5 to 6 months, then um, based on your circumstances, minimum duration will be 3 to 5 hours of preparation. If your if your if your timeline is available and you are able to prepare for 5 to 6 hours per day, then or more than that, then you can go for around 4 months of preparation. But minimum of 5 to 6 to go for the exam confidently and finish it off in the first attempt. So plan how you're going to go about. And second, create your own notes. That's the key. Because when you revise for the exam in the last week, so at the time you should have everything already prepared. You should just have to go through the documents rather than reading it for the first time. That will help you a lot. Um, Maybe mentally it will prepare you for the exam, kind of thing. And create a flashcard or Excel, which I showed you earlier. So create something like that so that you can remember the topic better. And once you have prepared, like you have planned your session like this, last 2 to 3 weeks or 3 to 4 weeks, it should be just for revision. And if you miss something, then you can read it 1 or 2 or 3 documents, but don't load yourself with new kind of stuff in the last 3 to 4 weeks. Just revise whatever you have done. And before the exam day, as always, Dr. Banji says, take good rest, have a good night's sleep so that you can concentrate on the exam better in the morning. So all the best. And finally, I cleared in September and I got around, yeah, I cleared well above the average score. So it was a clear, safe kind of pass rather than a border fail. So if you go ahead with this plan, then definitely you all will clear. So all the best. And I had a good teacher or great teacher with me. I was under Dr. Banji for the part one. So it's like I was reading like I was I was blind. I was reading everything which I come across, but nothing helped me in the exam because most of the documents which I read was never needed for the exam. So once I started practicing here, working under him, I realized most of the exam preparation is about the clinical practice. So it's about how it happens in day-to-day life in UK, how you get a question from the GP, how do you get a question from the ITU, how they ask you questions, or it's like a clinical scenario kind of picture. So that's one thing I realized after giving this exam. So this quote is which I dedicate to Dr. Banji. So any questions, you can fire it away now. Thank you for
Thank
patient listening.
thank you, Karthika. You made me very uncomfortable. But thank you.
You're humble
Um,
and down to earth. And also, please use Dr. Banerjee. Please discuss everything in the group. If you're not in UK, I will strongly suggest you people to discuss in the Moodle or micro registrar group because always he is available. He replies to your queries and yeah, use that because you're not in UK. That's kind of a disadvantage because most of the questions I answer with the clinical practice. So if even if you're not here, you can easily pass part one. But only thing is what resource you're going to use for the exam. That's the crux of the story. So if you get any doubt after reading the guidelines, just post it in the group so Dr. Banerjee can help you or any one of us can answer. But mostly follow Dr. Banerjee because everybody can give random opinions. Yeah.
Thank you. Um, and that's very kind of you. But yes, as Karthika said, that this exam is heavily, it's a unashamedly UK exam. So it follow what we do in the UK. So all of you are good microbiologists. You have your post graduation, so you know microbiology enough. What you do not know is what we do here. So it is not like you do not know microbiology. You do not know you probably are not that familiar with the UK practice. So if you're from outside UK, you are starting from a disadvantageous position anyway, because you are already experienced and you are already practicing in your country in your own way, which is appropriate for your country, but that is not appropriate for this exam, perhaps. So that is the struggle you are always going to have if you have never worked in UK. But that doesn't mean that you won't pass. You will pass, but it's difficult. So you need to know how to go about it. So you need to read the UK guidelines. You need to talk to people. That's where the forum. What I tend to see that some people join the forum and then just go mum, do not talk at all. So if you do not contribute, nobody will help. So you have to show your worth to other people. Somebody was asking in the microregister.com that how can I get a um, study partner. So if you do not have a study partner in your country, you have to use the social media to get a study partner. But if you just ask, I want a study partner, who will join you? They do not know you. You need to show them your worth. So you need to discuss in the forums. You need to discuss in WhatsApp. You need to put your question. There is no question, a stupid question. You need to just put it in there. Try to answer. Make mistakes if you want. Make mistakes in the forum rather than going to the exam. And if you are an active person, if someone shows that you are really practicing, you are preparing, you probably have more chance of getting a study partner. So do that. Uh, Use the forum properly rather than just keeping quiet. Uh, I will. I can't see any hands now, but I will open the floor to you. So if you have question, then you raise your hand, and I will go to each of you one by one. Right. So there is no hands here, but there is something in the chat. Okay. Stephen is asking, do we need to read about the antimicrobials? The antimalarial treatment, some antimalarial in Oxford Microbiology book is not there in the antimalarial UK treatment guidelines. Yeah, amodiaquine or tafenoquine. Okay. Um, Kartika, do you want to answer that?
Yes, because they don't ask about these drugs. Rarely they ask about one or two new anti-parasitic or antimicrobial drug, but they don't concentrate on extreme level of parasitology. Because if you think about this exam, one thing is in in the UK, the people who are giving this exam has just cleared the IMT training, that is internal medicine training, and they have passed the MRCP and just entered the microbiology. So they don't have the basic idea about the parasites, and most of the time we don't have malaria and other things until unless it is travel related. So they don't ask this kind of question like what we get back home in Asia. All these questions are common in Asia. Even if we are giving MD exams, we'll be bombarded with this question. But these questions are not for UK exam or for the FRC part one. They can ask you like if if a pregnant lady is traveling to a malaria uh, endemic area, what will be the treatment option you will use? Or if there is some contraindication like the patient is using antidepressant drugs and other things, what is the prophylaxis kind of thing you will advise? So those kind of the questions are common in UK. So I haven't faced this question, and most of the recalls which I have gone through from the UK candidates, they haven't faced any kind of questions in their exam as well. So you might get the mechanism of action kind of question, but this question is like beyond their level, so they don't concentrate on these kind of questions. They concentrate on the regular clinical practice. So mostly they ask questions like what is the travel prophylaxis you will advise if it is a pregnant lady, if it is a person with cardiac disease, if it is a person with depression on antipsychotic or antidepressive drugs. So that kind of question is common with malaria. Dr. Banerjee, if you need to add anything.
No, that is right. I mean, we are not really we do not get a lot of parasitology here. Malaria is mostly travel related, and there is two UK malaria guideline, one prophylaxis guideline and one treatment guideline. You probably need to see those two. And then if there is any new anti-parasitic treatment, just know the name and a little bit about it. They probably won't come. And we do not get a lot of parasite. We mostly get like bacterial infection and viral infection in this country. So the exam is quite heavy on those. And infection control also is quite heavy. So I kind of I agree with what Kartika said. Um, okay, how should we approach the guidelines? Again, I would probably defer to Kartika because she just did the exam, so few months back. How did you read the guidelines, Kartika?
So first, initially for the first attempt when I read, I did it wrong. So even this UK malaria guidelines, which Dr. Stephen Moses was asking about, I was reading all the guidelines diligently, but after 1 month, I couldn't remember any of the fact because I was not taking any notes from the guideline. So I forgot because I'm not practicing it. So if I'm reading it as like a document, it's easy to read it within 6, 7 hours and remember facts for 1 or 2 days. But if I'm not practicing on that, I'll forget it eventually. So before the exam, I couldn't remember any of those from the guidelines. So for the second attempt, what I did was, for example, which I showed you for a bacteria like pertussis, you will go through the UKSMI document first on the bacteriology or virology or parasitology, whichever it may be. Go through the Oxford Handbook for the microbiology stuff, a short glance of it, and then UKSMI on the same topic. And that will be followed by PHE document or the UKHSA document. And if you have missed anything apart from this, or if you're getting any points from BIA, just add to these notes. I created an Excel kind of thing by doing this kind of note creation. So one guidelines, I will aim for completing 2 guidelines in a day, around 3 to 5 hours per day. So I'll aim for one organism a day. So that kind of preparation I did for the second attempt. So you do not remember entire 23 pages on the guidelines. You just need to remember the gist. And Dr. Banerjee helped me sort out how to go ahead with the UKSMI. So there are only few areas you need to concentrate and read and remember in that, not everything in that. So just take your own notes. That is going to help you. So if you go to the UKSMI, don't read entire 23 pages, mostly the algorithm in it, the specimen processing in it, and then any particular investigation or gold standard investigation in it, and then PHE document for management and infection control precautions. That will do for an organism. So that's how you need to go about. I think I have answered the question. If you
Yeah.
have any more doubts, you can ask.
Yeah, so you're right. One way of reading the guidelines, I would say that you think about a patient. So when you are reading the UTI guideline, think that you have a patient with UTI and how are you going to manage it? So now you kind of read that what treatment. Okay, if I get a patient with treatment, sorry, catheter associated UTI, what antibiotic, what investigation I'm going to do? Okay, this investigation. What treatment I'm going to give? This treatment. Okay, if I get a penicillin allergy patient, what I'm going to give? So think about a patient, an imaginary patient, and go through the guideline thinking what you would be doing. And a similar question you have, do you need to read multiple guidelines? That Karthika already answered that yes, you need to read multiple guidelines, unfortunately. So when you are reading a organism, then you are reading about the organism itself, like what's the organism, gram stain, and those sort of things. And then you are reading about the demography, so where the organism prevalent. You are reading about what the organism can cause infection. You need to read about a little bit about the virulence factor that comes as question. You need to read about investigations. What is the best investigation? What are the best three investigations, what are the unique findings in the investigation, and they need to read about the treatment. You need to read about if there is any prophylaxis. You need to read about the lab aspect of that organism, and you need to read about infection control and public health. So you won't get everything in one guideline. Oxford Handbook used to be a very good resource, but as you know, it's now almost 8 9 years old now, so many things has changed. So unfortunately, you need to change it. So what you can do is that you can keep your Oxford guideline, Oxford book there, and then demography and those things will not change. But when you see that there is an outbreak going, you put a sticky note in Oxford handbook saying that there is an outbreak next to it, or right in the margin, or and then antibiotic, sorry, infection control or treatment. You put a note that read my own note about infection. You don't read it from there. So guide yourself from Oxford Handbook. If Oxford Handbook is your base, then you read it. But in those areas, you put sticky note or light write in the margin that you read this, and put it in your own writing. So that is one way of doing it. But yes, you need to read multiple guidelines. UKHSA, infection control guideline, public health guideline, treatment guideline, NICE guideline, many guidelines. It's a pain, but that have to do. And if you're thinking this is too much, part two is even more expensive. Don't want to scare you, but you really need to work on for part two. So more you read now, you'll be getting better for part two. Right. How should we approach the guideline? Okay, job related question will come later. I'll just see if there is anything that Kartika can answer. Thank you for your information. Yep, thank you. For one organism, we have, yep. Where can you previous year's question and similar resources for practice? You can't get previous year's questions stored in anywhere except RCPath guideline. RCPath has rule that it is not storable in electronic form in anywhere. So nobody legally can give you question like other exams, unfortunately. So you have to practice similar questions. BIA, the Learn Infection is a very good resource, and there are also questions in Moore and the orange book, the blue book, which is the tutorial topics. You can use those questions. If you have access to Moodles, and there are some questions in Moodles as well, but there is nowhere you can get all the questions. There are some model question in the RCPath exam. If you go to microregister.com, then there is a page where it says where you can get your questions. You can also practice USMLE questions, but be careful because when somebody writing USMLE book, they are writing the answer based on US guidelines and US problems. So they are not exactly our problems. Might be similar, but not always. So you need to be careful about that a little bit, especially if you do not know anything about UK guidelines. It will be dangerous to go start with USMLE books. So you need to have a thorough knowledge about UK guidelines and things. Then you practice USMLE guideline. So maybe something like once you have done other question, if you are still hungry for questions, you can go for USMLE books. Which books do you need to read for FRCPath medical microbiology exam? How did you practice for previous year's question? Previous year's question I have told you. Books, I think Kartika already told about the books. There are books there which roughly similar to the books I have mentioned in microregister.com. So you can go there, but books are a bit old now. So be careful about that. Um, okay. In terms of whether what's the job opportunity in UK and do you need to pass part two? No, you don't need to pass part two for job opportunity, to get a job in UK. You need to, however, have GMC registration. So the way of GMC registration is many. One would be PLAB and IELTS or English language exam. One will be full FRC path. One will be MRCP. One will be USMLE, Canadian exam, or Australian exam. So if you have any of these or sponsorship, then you can get GMC registration, and a postgraduate degree should be enough for you to get a job, a transgrad job in UK. If you have exam, it will increase your chance of getting a job because you will be better than other candidates in terms of your CV. So it is not necessary for you to get a job, for you to have exam for the job. You certainly need a post graduation in microbiology or infection specialty to get a job, and GMC registration. Nobody will wait for you to get GMC registration. So if you have your FRC path part one and you do not have GMC registration, you are unlikely to get a job. Because say if we are trying to advertise for a person to work with our team, we would not wait for you for that uncertainty to see whether you get the GMC registration or not. So if you're keen to work in the UK, I suggest that you work on GMC registration first.